For our research project, our group looked at the effect of promoting emergence of advanced knowledge on language skills and IQ of kids with autism. The purpose of the study was to determine if there was a relationship between the increase of language skills and IQ and the use of the peak relational training system in children with autism spectrum disorder. The independent variable is the peak relational training system, and the dependent variable would be the impact or effect of individual scores with autism spectrum disorder from ages 5 to 21 years old. Our research question was, does the peak relational training system increase language skills and IQ scores for the kids with autism spectrum disorders aged 5 to 21? Our research hypothesis was that the peak relational training system does increase language skills and IQ scores for kids with autism spectrum disorders aged 5 to 21. Just some information about peak and autism. Autism spectrum disorder is a developmental disorder that causes deficits with language and communication skills, as well as socialization. One common therapy that is used for individuals with autism is applied behavior analysis, ABA. ABA typically uses verbal behavioral therapy as their approach. Peak relational training system is a behavior-based approach to teaching advanced and basic language skills, and this has been specifically used with individuals who have autism spectrum disorder. Peak takes language learning to another level with the use of prerequisite training for equivalence and relational learning. This allows for derived responding, which is the relations without teaching. Peak includes 4 modules. There is the direct training module, generalization module, equivalence module, and transformation module. And between all of our article reviews, these articles used all of the training modules. So we decided to break up based on all of our articles to find 3 main points that were consistent between all of our articles. The first of these points was IQ. IQ has a direct relationship with language, social skills, and problem-solving skills. From the past studies, it was concluded that there was a strong positive correlation between the use of the peak training system and IQ. When peak was used, IQ scores did show improvement. Peak relational training system can be used by teachers, therapists, and paraprofessionals to build those skills that do directly strengthen IQ scores. From the study replications that we looked at, peak training system had a positive correlation between IQ and assessment scores. The second of our 3 main takeaways was language skills. The Verbal Behavior Milestones Assessment and Placement Program is a common assessment used to measure language skills. In our articles, in accordance with the VMAP, participants in a study increased and maintained those language skills after the use of the peak system. The skills acquired during the study were maintained when the assessment intervention was removed from each participant. The third takeaway that was consistent through all of our articles was teaching and implementation. Autism spectrum disorder diagnoses are increasing as the amount of research and knowledge surrounding the disorder has increased as well. Peak requires direct training for its participants, ensuring that those who implement this program have the proper tools they need to teach the curriculum to their students. Peak programming was found to be effective when individuals were provided adequate training. So if we were to create our own study, this would be our methodology. Our sample would be 4 children with ASD and language deficits in grades 7th to 12th. An initial assessment would be used to determine the baseline after the students completed the peak training. We would conduct a follow-up assessment to compare the results between baseline and 6 months of intervention. These would be the instruments that we would use, some subtests for vocabulary and IQ, the peak systems to assess their language skills, and an IOA data collection form would be used for fidelity checks as well with trained staff members. Our methodology continued. How we would collect our data would be between the peak forms, the peak E form and the peak DTA forms, for baseline data as well as intervention data. And then that would be what we would use to collect IQ scores for each participant, and as well as the IOA data. And these are our references that we used for our study. Thank you.